that it's something that will actually help us. No? So I think we'd like to encourage all of you, all of us, to actually accept and be accept the vaccination program. I think today's session will probably address some of the hesitancy that some of us may have, but as demonstrated by our colleagues from Santa Rosa, it was 100%, practically 100% acceptance, regardless of the vaccine brand. Because again, at the end of the day, clinical studies have shown, of course, I'm not a doctor, but I've also read through and joined some webinars. It appears that they're all very good. They all underwent the same kind of clinical trials. Of course, the trials vary depending on the results, but at the end of the day, there are also some nuances in the case of the trials on how they were conducted. But at the end of the day, they are effective in terms of, preventing you or us from, getting infected, as well as, more importantly, preventing us from being sick, even if we're infected somehow. But I think it's already quite effective. But in case we get sick, we will not be we will not be the critical cases, and of course, it will also prevent mortalities at the end of the day. So, and there's also, I think, preliminary research that indicates that even transmission of COVID-19 can be prevented by being vaccinated. So that will augur well, especially for our own families as we go home and interact with our loved ones. Definitely getting vaccinated will help mitigate the risk of actually transmitting it to our loved ones. And of course, within the hospitals that we operate, definitely if we can demonstrate to the public, of course, we will also, aside from that, before that, it will actually protect us from getting infected as we deal with our patients. And at the same time, it will also elevate the reputation of the hospitals where we operate as safe hospitals, safe zones that will enable us, hopefully, to bring back all the patients as well as the doctors. We encourage all of the doctors who have benefited or will benefit from this program to actually start bringing back those patients and convincing them that QualiMed hospitals, with all of our doctors and healthcare practitioners, including support staff, having been vaccinated, as a safe place for them to get treatment. So again, all of the positive benefits are there to our personal well-being, as well as our work environment, and of course our families, which are also very important, and our ability to secure more patients to start patronizing or restart patronizing the traditional services that we offer. So again, I just want to encourage everyone to take advantage of the opportunity today to listen to our subject matter expert and ask whatever questions you may have at the end of the session to dispel the myth that have always led to vaccine hesitancy and base it really on science. So again, thank you all for joining us in this morning's webinar, and I wish you all the best as we fight this COVID pandemic together as Team QualiMed. Thank you all, and have a pleasant morning.
Thank you, Sir Jaime, for those words. Now, to introduce our speaker, before I introduce our speaker, may I request everyone to put their microphones in mute so that it will not disrupt the course of our lecture. Thank you. So our speaker is a good friend and classmate of mine. Hindi ko alam kung paano ko siya napa-oo para sa lecture na ito despite the very, very, very short notice. Siguro kaya ko siya napa-oo because of two words. Gina Nazareth. So our speaker is Dr. Arthur Dessie Roman. He is a fellow and diplomate of both Philippine College of Physicians and Philippine Society for Microbiology and Infectious Diseases. He is currently the treasurer and board member of the FPSMID and the past president and advisor of the Philippine Hospital Infection Control Society. He had his fellowship training in infectious diseases from the UPPGH and his biomedical research fellowship under the Korean National Institutes of Health and Seoul at the Seoul National University. He also holds a master's degree with distinction in tropical medicine from the Nagasaki University Institute of Tropical Medicine. Welcome to the QualiMed Health Network, Dr. Arthur Dessie Roman. Over to you, Des.
Magandang umaga po sa ating lahat. Doc Mark, nakikita mo ko. And I am trying to share my screen.
Yes, kita-kita.
If the host can allow me to. I am still unable to share my screen.
Tay?
Na lang po.
Yeah. You're the host now.
Ayan, okay na. Yep. So you should be seeing a white screen right now, Mark.
Yes.
And here's the title slide. I know that the topic earlier is about vaccine hesitancy, but for this morning we will focus about COVID-19 vaccines. And I'd like to thank the organizer of this event for inviting me, because really we would like to invite everyone to receive their doses of the COVID-19 vaccine. May I request the host to kindly put everyone on mute? Sorry po. Sige po. Before I proceed, let's even discuss the rest of my slides. Kailangan malinaw po sa atin, and we should be able to make the decision. Kailangan ba talaga natin ng bakuna laban sa COVID-19? And our answer should be opo. Opo without reservation. Opo nang walang pag-iimbot at ng buong katapatan. Bakit po? Okay? Kailangan natin ng bakuna laban sa COVID-19 dahil ongoing pa rin po yung pandemic. There are around 30,000 active cases right now, at 5.6% po sa kanila ay malala at critical. Iba po sa kanila ay nakalagay sa tubo, naghihinga lang. And there's a total of around 12 deaths already because of COVID-19. We've had friends, we've had family doctors, nurses na namatay because of COVID-19. Not just that, according to President Duterte, in an briefing 2021 per day, as we fund, and there are nearly 1,000 established, pero permanently closed as of September 2020 because of the pandemic. So we should be aiming at stopping COVID-19 pandemic dahil ang dami naapektuhan. And pinakamahusay na paraan upang tapusin ang COVID ay ang babakuna. Mark, pwedeng pa-mute ako. So,
And the host,
number one, support. Kapag nagbabakuna po, may iwasan yung pagkakaroon ng COVID-19. Okay? So, yung mga symptoms at na COVID-19, yung may ubo, may sipon, may iwasan po na hindi yung marin or yung pagkaya ay kung magkaroon man tayo ng COVID-19, hindi po tayo probably as we gain more information on COVID vaccines, sana ay yung mga bakuna na ito ay maiwasan ang pagkalat ng COVID-19 in the community. So, babalikan ko lang po yung tanong. Kailangan ba ng bakuna laban sa COVID-19? Opo, kailangan po natin yan. Ang COVID-19 na bakuna ay ang sa pagtatapos ng 19 pandemic. Ngayon, may tanong po ako sa inyo, you can type the answer chat box. True or false lang po. Hindi ligtas ang mga bakuna laban sa COVID-19 dahil minadali ang paggawa sa mga ito. So tignan ko po yung ating chat box. Ilan po yung sa inyo magsasabi na true, minadali ang COVID-19 vaccines, or false, hindi po? Yan. Wala pong nagta-type sa ating chat box. Pero ang sagot po ayan, may naglagay po. True daw po. So ang sagot po sa statement na ito ay false po yan. Okay? Alam po nating lahat na na-fast track yung pagre-release ng COVID-19 vaccines into the Philippines and other countries. But yung mga na-fast track po na part were the regulatory approvals, yung funding, the data analysis, and submission to FDA. These are all paperwork items. Kumbaga, kinat po yung mga red tape. What was not fast-tracked was the enrollment of the patients, yung pag-follow up po sa mga pasyenteng ito, making sure that they are safe and we are monitoring yung mga posibleng side effects that they develop, yung capturing of the events which might have occurred during the follow-up. And remember that these clinical trials were executed very well. Ito po mga clinical trials regarding or involving the COVID-19 vaccines ay inaprubahan po ng mga ethical review boards ng kanya-kanyang mga institutions. We are talking about emergency use authorization because yung mga bakuna po na ginagamit natin ngayon, yung Astra, Sinovac, sila po ay naprubahan for emergency use authorization or EUA. So ano ibig sabihin ng EUA? These are medical products gaya ng vaccines that are made available before a full application is approved by the Philippine FDA. And for you to receive an authorization for emergency use, yung mga nagde-develop po ng vaccine, they must be able to demonstrate na epektibo ang mga bakunang ito at kapag ginamit sa mga tamang group of patients, yung benefit will outweigh the potential risk of these interventions. Yung EUA po is not a lower standard. It's just that it's a more tailored, a more flexible standard for those while still gathering evidence make the point of a COVID vaccine. So the basic premise that for vaccines to be made available to the public, kailangan ay nagdaan po siya, undergone careful testing. Yung ating pong mga bakuna, they all go through clinical trials to test their safety and their efficacy. Number 2, the authorization for emergency use is to be issued by the Philippine FDA considering the safety and efficacy of these vaccines, and there should be a process for continuous monitoring for the development of whatever problem and side effects of these vaccine recipients. And the DOH will have a system for short-term and continuous monitoring for at least 1 year sa mga pasyente na nakatanggap ng COVID-19 vaccines. And so, we should be able to give our trust. We should trust that if FDA grants a vaccine brand the emergency use authorization, then it is safe and it is effective. Tumungo po tayo ngayon sa paraan kung paano ba gumagana ang mga bakuna laban sa COVID-19. 3 steps lang po yan. Okay? The first step is nag-i-inject po ng mahina o kaya ay patay na virus or nag-i-inject ng isang portion ng virus o kaya ay isang mRNA na kagaya ng sa virus sa katawan ng isang pasyente. So itong mga components po na ito ang inilalagay doon sa hiringgilya na i-inject po sa atin. Kapag ang mga components po na ito ay itinurok na sa pamamagitan ng pagbabakuna, yung bakuna po ay uutusan ng ating immune system na gumawa ng mga antibodies. Ito mga antibodies na po ito ang lalaban doon sa mga virus sakali mang ma-encounter natin sila uli in the future. Sakali mang in the future ay ma-expose tayo sa COVID-19 virus sa community, Inihahanda ng bakuna ang ating katawan upang kilalanin at labanan ang virus in the next encounter. And finally, sa susunod po na ma-expose tayo sa virus, yung katawan natin ay meron ng antibodies upang labanan ang SARS coronavirus 2. Therefore, hindi na magkakaroon ng sakit o hindi na magkakaroon ng malalang sakit sakali mang magkaroon tayo ng COVID. Kung anong klaseng bakuna po yung ating matatanggap. Okay? It depends on the components of the vaccine, the antigen that is being injected, ano po yung type ng vaccine. So it can be a viral vector vaccine, it can be an mRNA vaccine, it can be a whole virus vaccine, or it can be a protein subunit vaccine. Iisa-isahin po natin yan. Pero let's consider the type of vaccine brands na meron dito sa atin. Sa ngayon po, di ba, meron na tayong Sinovac, tapos available na rin sa atin yung AstraZeneca na vaccine. And initially po, akala natin ang maunang darating sa Pilipinas ay yung Pfizer vaccine. So yung Sinovac po, Mark, pamute ako. So, yung Sinovac or yung Coronavac vaccine po.
Sorry ah. Saan ko lang oil? Ha?
Miss Ethel, pakimute po.
Oh. Ay, sorry.
Yung Coronavac po is an inactivated virus vaccine. Samantalang yung AstraZeneca vaccine naman po from the United Kingdom and yung Pfizer, it's an mRNA vaccine. Isa-isahin po natin kung ano yung mga klase ng bakuna na ito. Yung inactivated virus vaccine po muna tayo. So yung inactivated virus vaccine ay yung dead virus or inactivated virus ay inilalagay po sa bakuna at ini-inject po sa ating katawan. And this dead virus triggers the immune response para po mag-produce na yung ating katawan ng antibody. So when we meet the live immunity, ay ready na po tayo para labanan yung SARS coronavirus 2. Doon naman po tayo sa AstraZeneca na vaccine. It's a viral vector vaccine. Ano yung ibig sabihin ng viral vector vaccine? So ang ginagawa naman po, ang ginagamit ng viral vector vaccine ay pumipili po ng isang virus na hindi nagkukos ng sakit sa tao. Sa kaso po ng AstraZeneca vaccine, gumamit po tayo ng adenovirus. So nag-inject po tayo ng isang portion, isang gene, galing sa SARS coronavirus 2 at in-inject po natin yan dun sa DNA ng adenovirus. And then the adenovirus will be injected to the patient. Okay? Ang gene ng SARS coronavirus ay isinasama sa isang harmless virus, kagaya ng adenovirus. Ito po ay ini-inject sa katawan at yun pong harmless virus na naglalaman ng gene ng SARS coronavirus 2 ay nagpaparami ng kanyang DNA kasama ang gene galing sa SARS coronavirus 2. And yung mga nagawang DNA na merong gene ng SARS coronavirus 2 ay nag-uutos sa katawan upang gumawa ng mga proteins na kamukha nung sa SARS coronavirus 2. And therefore, kapag na-expose na po yung ating katawan sa proteins na kamukha ng SARS coronavirus 2, okay, kapag tayo ay na-expose sa SARS coronavirus 2 na may mga protina, then ready na again yung ating katawan na maglaban, na lumaban because we have already produced the antibodies again. Yung RNA vaccine, an example which is the vaccine, yung isang bahagi ito RNA ay inilalabas tapos yun po ay ini-inject sa ating katawan. This is inside our body. Pagka-inject sa loob ng ating katawan, yung mRNA po ay nag-uutos sa cell o coronavirus, and then natin ulit yung mga protein na expose coronavirus 2 in the community, tayong produced laban itong SARS coronavirus. We are talking about vaccines, but it consider this historically po, yung influenza vaccine kaso, di ba, every year dapat general population ay makat sa vaccine. It has a 50 to 60% vaccine against influenza A and 80% against. Kung titignan po, naman kataas with a of percent, inire-recommenda pagbabakuna against influenza. It prevents influenza, severe influenza. Next thing that yung World Organization po suggested that a clear demonstration of efficacy ng mga COVID-19 vaccine, ang minimum lang naman po is at least a 50% point estimate. This should be a minimum criteria for any acceptable COVID-19 vaccine, whether vaccine efficacy against getting the vaccine or in preventing disease, severe disease, or preventing the transmission endpoints. So, ito po yung mga nai-report based on clinical trials na vaccine efficacy ng iba't ibang bakuna na kilala natin. Sa CoronaVac po, sa Sinovac, against COVID-19 na mild disease, the vaccine efficacy is 50%. Mild, in Indonesia, it's 6, but in Turkey, ang kanila pong nai-report na efficacy is as high as 0.25%. But preventing yung malala AstraZeneca, ang efficacy po is 64.1% at 70.4% after receiving the second dose. Hindi naman po masyadong malayo yung vaccine efficacy against getting COVID-19 ng AstraZeneca at ng similar Sinovac vaccine. AstraZeneca vaccine can prevent severe COVID-19 100%. Yun naman pong sa Pfizer, it's at 94.6% mula it's 100%. Medyo mag-kasi in preventing COVID-19. Lahat po ng mga bakuna alam po natin na other than efficacy, mahalaga rin na which factors sa pagro-bakuna. Number one, kailangan consider po natin ang safety, ang cost also, and not just the unit cost of the vaccine. Because remember that for every type of raan, kung paano tinatransport at kung paano ini-store ang mga bakuna. Halimbawa po, ang Pfizer vaccine, kailangan po kapag siya ay in-store, itinago, minus 70 degrees po na freezer yung gagamitin natin. So hindi po yan yung usual na freezer na ginagamit natin sa ref. Kailangan ng special freezer sa pag-store ng COVID-19. At kung tayo po ay bibili ng special freezer na ito na minus 70 degrees Celsius, kailangan isama din po natin yan sa costing ng pagbabakuna. Of course, we should also look at the other important outcomes, not just in preventing COVID-19, but kagaya ng sinabi ko po sa inyo, in preventing the severe form of COVID-19. And with the present vaccines that we have right now, almost all of them are 100% protection from severe COVID-19. COVID-19. Again, availability and access po ay hinighlight ko dito because maaga pong efficacious na bakuna, pero dapat ay meron tayong access at yan pong bakuna na yan ay available para sa atin. Because aanhin po natin ang isang 90% vaccine efficacy na bakuna kung next year pa po natin pala makre-receive. So aanhin mo pa ang 90% vaccine efficacy na bakuna kung ang kabayo ay patay na. Okay? Mga bakuna. Hindi naman po natin dinideny na merong side effects ng kahit anong vaccines. May mga side effects na naiulat sa mga phase 3 trials, subalit halos lahat sila sa magaling. And in general po, mga any of mga resistant po na magkakaroon muna ng bag at titig nurse kung kayo po ay specific ingredients po na health diabetes po and absolute contraindication para kayo makatanggap ng COVID-19 vaccines. Necessarily, kung sa ako ibigay yung na ay nagka-headache and some patients develop fever at nag-chills and some ay nagkakaroon po ng pagpapantal, inuubo at okay? Very rarely bios para sa mga pasyente na magde-develop ng anaphylactic reaction. Okay. So tandaan, kailangan natin at ibigay ang sa COVID-19 now ibang vaccine disease at ng malalang at vaccines bagamat kung EUA approved, FDA approved ang isang bakuna or later on recommend na rin po siya ng HTAC or ng National Immunization Technical Advisory Group, panatag po dapat ang ating loob na ligtas at epektibo ang mga bakuna. Alalahanin po natin na ang mga dapat pagkatiwalaang muli. Ibalik po natin ang ating tiwala sa bakuna. Now, in the next few slides po, I will go personal. Ganito po yung aking naging paraan on how I will decide to receive the COVID-19 vaccine. Ito po kasi yung aking mga agam-agam. Number 1, may mga bakuna po tayo. Halimbawa, yung Sinovac, ito po ay galing sa China. At marami po sa atin ay nagkakaroon talaga ng doubts na makatanggapin sa China. Po natin alam yung data tungkol sa Sinovac kasi wala pa pong published na research paper Sinovac vaccine. Next, mas mataas po yung vaccine efficacy at iba pang bakuna. And then, the research next vaccine our own health kung we want test for our own health. In fact, last Saturday ako, tinext ako ng tatay ko, sabi sa akin, Des, huwag kang magpapabakuna ng galing sa China. Ha? So, paano ko po sinagot yung aking mga agam-agam? Okay, paano ko sinagot sa aking sarili? Number 1, sabi ko sa sarili ko, we have to focus on the scientific evidence. We have to skip politics. We have to skip the bias. Kapag nandyan po ang isang produkto, whether galing yan China or galing ng United Kingdom or ng United States, we have to focus on the data, on the research publication that is available to us. And in the absence of any publication, alam ko naman po na bangabat ang data na meron tayo ay galing sa mga press release at unpublished NIH data na evaluate naman po ng FDA ang mga papel na isinabmit ng Sinovac. At maging ang NITAG po ay naglabas na rin ng recommendation na maaari pong matanggap ng mga healthcare workers ang Sinovac. Na-realize ko po na araw-araw po akong tumitingin ng pasyente. Ngayon po, nagkaroon tayo ng increase in the number of COVID-19 cases. At marami po akong mga severe COVID-19 cases na inaalagaan ngayon. Na-realize ko po na kailangan ko ng protection against COVID-19 ngayon na. Sabi ko nga po, aanhin natin ang 90% vaccine efficacy kung ang kabayo ay patay na. Sabi ko sa sarili ko, ayoko pong maging patay na kabayo, kakahintay ng COVID-19 vaccine. Tayo po ay nasa gitna pa ng pandemya. Ang supply ng bakuna ay kulang pa. Maaaring ako po ay may choice right now. We might have a choice right now. May choice tayo na gusto ba nating makatanggap ng bakuna or ayaw nating makatanggap ng bakuna. Or some of us, meron po tayong choice. Ang pipiliin po ba natin ay ang AstraZeneca or ang Sinovac. Okay? Pero hindi po lahat sa atin ay merong choice. Mas marami po sa atin ngayon ang walang choice. Gusto ko lang pong i-share sa atin yung experience ko po. 2 weeks ago po, nag-birthday po si Mamang. Yung lola ko po yan. Okay? And nung nag-birthday po siya, nasa kalsada po kami because hindi po kami pinapayagan na pumasok sa bahay ni Mamang. And so, we really had to celebrate her and protect her from getting COVID-19. Kaya sa labas lang po kami and si tita lang po yung kasama niya sa loob. Si Mamang po, matanda na siya. She's over 8 years old. Isa po siya sa mga walang choice right now at this point of the pandemic. Okay? So gusto ko lang pong ma-realize natin that getting a vaccine is actually a privilege. But getting a vaccine right now is a higher privilege for us healthcare workers. Right? And this is the reason why during the first day po ng rollout ng vaccination program ng Department of Health done in PGH, I decided to have myself vaccinated using the COVID-19 vaccine. Okay? So remember, vaccines work, tiwala lang po, and thank you very much for your time. Sa mga nagka-receive na po ng bakuna, maraming salamat po, and we have already again contributed to the control of the COVID-19 pandemic, and dun po sa mga healthcare workers, sa mga tao na nag-iisip pa kung magpapabakuna po sila, continue to read information, patuloy niyo pong kilatisin ang data about COVID-19 vaccines, pero kami po ay umaasa that at the end of the day, ang magiging choice niyo po ay ang magpabakuna. Maraming salamat po at magandang umaga po sa ating lahat.
Thank you, Dr. Roman, for that very informative lecture. Sorry, naririnig mo ba ako? Sorry, I have a problem sa
Yes,
Wi-Fi.
Mark.
Yeah. So, thank you for that lecture.
Mark, naririnig ka?
Do we have any questions right now for Dr. Roman? Especially, sorry, maingay si Trisha dito sa likod ko, Des. Do you have any questions for Dr. Roman? If you have any question, please type it in the chat box and we will forward it to Dr. Roman. Siguro as the moderator, maybe I'll shoot the first question, Des. What if, can we combine brands? Those one would be Astra and then those two may be Sinovac or the other way around. Is that
Hindi po natin
allowed?
Dapat stick to one po tayo. Ang recommendation po right now is kung ano po yung bakuna na natanggap natin for those one, we should complete the recommendation in terms of the number of days at matanggap yung same brand of the vaccine. Hindi po pwedeng palipat-lipat sapagkat wala po tayong evidence na magiging epektibo yung bakuna kung nagpapalit-palit po tayo ng brand. Sa Mark, sa chat box nakalagay, any recommendations for senior frontliners regarding vaccine? In general po, sabi ko nga, walang contraindication sa pagtanggap ng COVID-19 vaccines. Ang approved na use po ng Sinovac would be for people aged 18 to 59. Kaya po for senior citizens, baka po yung AstraZeneca yung kailangan nating matanggap. Again,
Correct.
if we decide to receive as senior citizens, pwede naman po. Pero we should weigh the benefits senior citizens and senior citizens na doctors who decided to receive the Sinovac vaccine.
Okay. Next question is, will you suggest the vaccine in persons living with HIV?
Doc? Yes, Mark.
Yeah. Will you suggest the vaccine to persons living with HIV?
Yes, no problem.
Yeah.
Yes,
How-
especially if the comorbid condition, if the HIV disease is controlled.
Okay. Whether Sinovac or Astra?
Whether Sinovac or Astra.
Totoo ba daw yung napapabalita sa ibang bansa na matapos
Mark,
maturukan? I'm sorry? Hello?
Go ahead.
Yeah. Totoo daw ba yung napapabalita sa ibang bansa na kapag naturukan ng bakuna ay nagkakaroon ng mga blood
Go
diseases?
ahead, Mark. Okay. Wala pong nag-develop ng mga blood diseases, yung mga nakatambak. Can be rare size blood. Yung makakakita po tayo ganitong kasing information. Sana po ay yung source ng information are from reliable sources. Baka naman po kasi yung mga source of information natin are just hand-me-downs, yung mga pasa-pasang information. And this can be information that are being perpetuated by anti-vaxxers po and without really any basis. Ang point po, let's make sure that our source of information is something that's reliable. Doc Des, pwede po ba na we can have two vaccines like 2020 Sinovac, then 2021 another vaccine for... Well, this is possible, but this point in the pandemic, and we don't know the status of the pandemic right now, sana po we stick with one brand and then let's give others the opportunity to receive the vaccine. I think that's our parang responsibility natin sa ibang citizens of the world. Good afternoon. If ever we experience side effects like fever, etc., are we still allowed to go on duty? Is it okay to stay with our family in one house from them? So the way we assess the development of signs and symptoms is titignan pa rin natin if pasok po ba sa COVID-19 na suspect. In general po, if the side effects that you will experience is just mild fever or chills without respiratory signs and symptoms, and this is within 24-48 hours after receiving the vaccine, then this can be side effects that are referable still to the vaccine and not really COVID-19. But definitely, if you develop respiratory tract infection, shortness of breath, together with fever, then you have to be managed as a case of COVID-19 suspect. Doc, is it safe for pregnant women? Right now, po recommend routine immunization of pregnant women with COVID-19 vaccines unless meron po tayong special considerations. Number one, if the pregnant woman is a healthcare worker and is at risk of getting COVID-19, or a frontliner at risk of getting COVID-19. And number two, if the pregnant woman has comorbidities, meron po siyang mga kasabay na sakit that will put that pregnant woman at risk. Kung ang condition na yun, yung buntis na pasyente, then pwede po siyang makatanggap ng COVID-19 vaccine. In general po, the type of vaccine, yung inactivated vaccine and other vaccines, they are generally safe for COVID-19 for pregnant individuals.
Pwede pala din sa laptop mo.
Yes, Des. Actually, I'm back. But
Next question. What if a person had an allergic reaction to the first dose of Sinovac? Can she get the Astra-Janssen vaccine for the second dose? I think the answer is yes, because these different vaccines have different ingredients, but we might have to on which COVID-19 yung ibibigay natin after developing the allergic reaction from the first dose, because yung PEG, yung polychloride, it's also an ingredient of the other. So you just have to make during the check yung active ingredients ng mga bakuna. Here you go. Products compared to that now, more the side effects are generally mild and well tolerated and transient. We don't have any head-to-head data comparing the different vaccines, but what we know is that in general, these available vaccine brands, minor lang yung kanilang side effects. How soon or late can a person who has tested COVID-19 positive be vaccinated? Kailangan pong kumpletuhin muna natin yung recommended na quarantine and be released from the quarantine. And in general, the recommendation po is you can get vaccinated after recovery from COVID-19, 90 days after the infection. Huwag po tayong pupunta sa vaccination center na tayo po ay may nararamdaman, na may ubo, may sipon, or may lagnat. Kailangan po naka-isolate po tayo, especially if we are surely covered already and we self-isolation duration. After vaccination, there is no need for you to isolate yourself from the rest of your family members. Are there any more questions po? I don't see any more questions, any additional questions in the chat box.
May isa pa, Des, sumabol yata.
Solution of infection. It is based from initial study and the duration against COVID-19, it starts to wane after 90 days. Okay, but in general, that recommendation is in 90 days from receiving the vaccines is in settings where there is a shortage of vaccine. But the answer is beyond 90 days, do nagsa-start mag-wane yung protection from COVID-19 after you get it. Any more questions, Mark?
I think wala.
Des.
Dai, go ahead.
Oo.
Yes, ma'am. Yes, ma'am,
about
Gina.
What can you say about the recently, yung nirelease kanina ng CDC, yung guidelines? Would you like to comment on that?
Sorry ma'am, I cannot comment yet. Hindi ko pa nababasa yung full document.
Hindi pa. O siya, sige,
But
it's okay.
is there any specific question? Sorry po Opo.
Kasi medyo nag-lax
Kasi
na siya.
nag-klase ako kanina, kaya hindi ko pa
Medyo
nabasa.
nag-lax na kasi siya. Once na nabigay daw yung vaccines. It's okay.
Sorry po, I cannot comment about that document.
Yeah,
Sorry.
it's okay.
Hindi ko pa siya nababasa. Unless maybe Mark has read it, but ako na. Okay.
Pinasa kay Mark.
Preliminary data on the length of protection that vaccines will provide. 3 months po, but we still have to further observe the duration of protection from these COVID-19 vaccines. All of these studies are still ongoing para malaman natin kung gaano kahaba yung duration of protection. And the reason this is especially important, kaya nga even with the vaccination ay hindi pa rin natin dapat kalimutan yung minimum public health standards that are being recommended. So hindi pa rin po natin pwedeng tanggalin yung face shield, yung mask, physical distancing, and hand hygiene. Mark, any other concerns, Mark?
I think that's about it. If there are any other questions.
There's one last question, Mark.
Meron pa pala.
May nakalagay dito. Doc, if one is allergic to ibuprofen or naproxen sodium, is the healthcare worker still eligible for COVID-19 vaccine? Yes, still eligible. Hindi contraindication ng allergy to ibuprofen or naproxen, but what we usually do is, of course, we proceed with caution and make sure that after you receive the vaccine, monitor po kayo. Thank you very much po.
Okay, I think that's it. Thank you, Dr. Roman, for that very, very informative lecture. Special shout-out sa aming mentor also, Dr. May Vinagracia. Hi, ma'am. Thank you for being here. With that, I'd like to call our Chief Operating Officer of the QualiMed Hospital in Iloilo, Dr. Nathaniel Chan, to close this talk. Sir, good morning.
Good morning, Mark. So, good noon, everyone. In behalf of the QualiMed Health Network, I would like to thank everyone, especially all our doctors and employees who attended this morning's PSQM lecture on Kilalanin ang COVID-19 vaccines. This lecture is actually for all of us who may be having doubts or second thoughts in receiving the vaccines that are being made available to us. I would also like to thank our corporate PSQM and marketing teams, especially Dr. Gina, for helping us organize this event in very such short notice, and to Dr. Mark for ably moderating today's event. Of course, I would like to commend and express our gratitude to Dr. Dessie Roman for his very comprehensive and informative lecture on the different COVID-19 vaccines. I am definite that this lecture has cleared up a lot of uncertainties and has provided us with the right information that will guide us in our decision to receive the COVID-19 vaccines. I would therefore like to encourage everyone to grab the opportunity to be vaccinated at the earliest time possible. The sooner we get the shots, the earlier we protect ourselves, our families, and our community, and together we can beat this COVID-19. So again, thank you everyone, and have a pleasant day to everyone.